Right. Well, we'll go ahead and call this meeting to order at 1:02, and I will do just a roll call visit. Do we need to record this meeting? Looks like we are. Great.
Yes.
All right. So, Vice Chair Smith,
Present.
uh, Mayor Dean,
Here.
Commissioner Hunthausen,
Here.
myself, Wes Feist, and is James on? Okay. We do have a quorum though without James, and so we can go ahead and begin. The funding recommendation, we have $69,153 remaining, and we will have $400,000 that will be available after July 1. So as we have discussed in the past, this spring meeting is for review and then funding, knowing that the funding actually hits July 1. But our goal is to not necessarily use it all up because we will have a fall funding as well, but to use up some of this. And so we will go ahead with that in mind, knowing that we have 469,000, but that the goal is not to use all of that up one time. Approximately $234,638 for the spring funding. We don't have to necessarily vote on each one of these all at one time. We may have to hodgepodge things together. And so, but did want to get your perspective on all of these. So we have the St. Peter's Health Foundation application. Do we have any thoughts on that?
Mr. Chair, as a reminder, that one is,
I'm sorry,
that
you're
funding
correct.
has already been out. You still have to approve it, or not approve it, but that funding has been allocated already. So that is not part of it.
Excuse me. As far as the St. Peter's Health is concerned, do you have any questions about their application or their 6-month review document that was in the document that was sent? All right. Yeah, we're not looking to fund that one again. Excuse me. We did have Lewis and Clark Public Health. That was the Grow Together, expanding the universally offered home visiting to address the opioid epidemic. Thoughts on that?
I was looking at their answer if they could, what they could do with reduced. Looks like they just wouldn't hire. Trying to get down to it. The 16,000 would be the amount they'd request as partial, and that is just for the home visitor, taking out supervisor's evaluation and indirect expenses. I would be more liable to vote for it at the reduced amount.
At the $16,000. Okay.
That's where I was as well.
Mr. Chair, I agree. And I like the direct service, working with people directly, and the opportunity, I guess it would be, to address folks from a prevention and recovery, as well as referral to treatment potential for that one, but at the reduced rate if we go there. So just 2 cents.
Okay. So this is going to be a fun task for Eliza and or Amanda and Nancy, if you could, to try and keep track of our thoughts
amounts
with numbers as we go through this, the Rubik's Cube of numbers. So, okay, good perspectives.
Oh, can I add one more thing to that one? I had written when I first reviewed it that it might be better for Region 4 because it's a multi-county. Just throwing that out there.
And I'm going to look up the...
Because they said they could go to Broadwater, Jefferson, Deer Lodge, I mean, I would rather see them get the full 26 from Region 4 if they could get
But,
organized.
but then that would not include Lewis and Clark County.
I mean, it could, depending on what Region 4 says. Because we're in that region, but yeah.
But their funding is not funding this county.
Right.
Yeah. And that may be something that we could recommend to the overall moat, as far as if we were to fund a portion of it, that it would be, I don't know if you'd want it contingent on the funding then from the other region. I don't know if we want to put someone else in that position, or that we recommend that they seek the additional funding since it impacts people in those other counties.
Yeah, unless we want to think about just funding half of their total ask, which then would be 13,000.
I guess
Okay.
maybe that was one of my questions. If there are any procedures that are in place to help coordinate in these like kind of multi county issues.
No, we kind of tried to see what we could get, and there wasn't. And from my knowledge, I'd lean on the staff. We haven't gotten anything else about what that would look like. And I don't know that any of the other regions or metro counties are funding things in that manner. We had hoped there would be more that would come, like reserve a portion of the money and then those go to statewide or multi-region projects. But we never got any of that direction.
Okay.
Just a note on that, the home visiting, probably 80 to 85% of the visits are going to be in Lewis and Clark County. It's just because of the population, that's where the people are. So, thus, the great majority of the money would be spent here, likely, and the reason that they have those partnerships where Lewis and Clark Public Health would go out to those other counties because they don't have the infrastructure to do that. So they essentially contract back to Lewis and Clark for that regional home visiting process. And all the bigger counties around the state are in that same boat, where the smaller counties that don't have as many resources are asking the big counties to provide some of those services in the surrounding counties. Just a note for understanding how it works.
Okay, good conversation. We will move through the agenda and then we'll come back to these to say yes or no. But just to get a perspective, Good Samaritan Ministries, the Stops campaign, this is one we have funded that they're requesting another round of funding. I think that it has been a good opportunity for Good Samaritan. I do know that they were hoping to have gotten further ahead at this point than they were, and didn't, it doesn't sound like. So I don't know, to me, that funding even more is, if you're not doing what you had hoped to do in the first part, to then increase the amount and hope for more in the second. I don't know that that's a strong method to move forward on, but I think that they've done good work, and I think that they're the only folks out there on the streets helping people who need it most, not from the prevention side, but from the maybe treatment and understanding. And what are other people's thoughts?
I would really advocate. I'm very supportive of the 100,000. I think the additional, I am not opposed to, but we obviously have limited funding. I do think that just after the steps that they've taken this year to really get their operations kind of firmed up and some processes in place, I know we're seeing improvement. And I do think it'll probably make a big difference, given that our place will now have like a permanent home where they can help bring folks in. The city just gave them 134,000 for the build out at Good Samaritan Ministries for the permanent art place. So I do think that having a permanent home is probably going to make a big difference for them in bringing vulnerable folks from the street outreach into our place, getting them to treatment and access to support. So I'm very supportive of this program. I'm totally open to the conversation about whether, the 130, I think, 35 is, if it needs to be that much, but the 100,000, I'm very supportive of that for sure.
And that's where I'm in the same boat on that.
Me too. I don't need to repeat all that. I agree with the mayor and the U.S. 100,000 is where I'm at. That.
Colleen?
I don't have their budget in front of me, but Mayor, you just said that they were receiving 134,000 from the city. Was any of what they were asking from us as part of
No,
this? No,
no, it was strictly just to build out the space in Good Samaritan. And Amanda could probably speak more to because she just worked on the contract, but it was general fund savings from ARPA that we had set aside for them, like for the last 3.5 years. And they now have, I think, the leadership and plan in place to be able to implement. And their lease is ending in the old Restore building. Like this month. And so their permanent home will be Good Sam's. But Amanda, you could probably speak more directly to that.
Mr. Chair, Mayor Dean, yes, that's my understanding of the situation. So they are currently leasing from Habitat for Humanity in that Restore building on National Avenue. That lease is ending. They're moving even before the renovations happen at the thrift store building. They're going to be moving their operations for our place to the thrift store in kind of a temporary situation. And then the funding that they received, again, was general fund savings that came from the influx of ARPA funding to the city and was allocated in 2023. So it was essentially sitting and waiting for a project from them because it was initially allocated for the Roos Place women's shelter, which was going to be at their old facility on Main Street, Last Chance Gulch. And then that building was bought sort of out from under them and they had to move operations. The Roos Place shelter ended up sort of being taken over by Family Promise, and then our place was sort of adrift. So, but the 134,000 is strictly for capital for them. No operational costs.
Okay. Thank you.
Okay. Pureview Health Center, the transcranial magnetic stimulation. I'll be happy to start. I think that it could be a great opportunity, but I don't know that it's the right opportunity for us for funding at this time. In my thoughts, anybody else?
Agreed. Yeah, I don't think there's a strong enough tie to opioids. I mean, it's always going to be co-occurring with any type of drugs and depression and mental health, but it's just there's not a strong enough link for me.
Mr. Chair, I agree. Great instrument, great tool, but with the resources we have and the direct connections, I think Colleen said it once.
And I think there could potentially be more appropriate sources of funding for like capacity building, maybe at St. Pete's where it's already happening or otherwise, but I would agree with the rest of the comments.
Okay. Recovery Friendly Montana.
Mr. Chair, their response said they were going to continue to do the work whether we funded them or not. So if we're tight on money, I'm leaning towards not, but
Yeah, I've struggled with this one throughout because I know that a lot of health plans help with this and organizations help with this. And I think with the funding, again, trying to target a very narrow group within a very broad scope. is tough when we have limited funding.
When I guess I was a little bit confused about, because they're based in Missoula, if I recall correctly, and I don't necessarily know that I saw the guarantee of, Lewis and Clark County based employers, getting direct benefit from X number of dollars.
Yeah, it's a large approach, and if I'm not mistaken, I do think that in years past, when they originally submitted an application, it was in every region of the state. Vice Chair Smith, you might correct me if I'm wrong on that, but I think that they had applied before for a wide swath of funding.
They
and
did.
Yeah, and they may have gotten it from some regions. I haven't looked. I don't know.
I don't know either.
Mr. Chair,
But,
again. Oh, sorry.
Go ahead.
No, I was just going to say I agree with all those comments, and yeah, I would not support this one at this time with what we have and the situation we're in. So,
Okay. We'll move on to Montana Legal Services then, the Montana Health Justice Partnership. This is similar, great program. I get what they're doing. I think it is beneficial, but being tasked with helping to fund opportunities to reduce and help those with specific opioid use disorder or those afflicted by that, this is a harder sell under the circumstances.
Agreed.
yes, Mr. Chair, much needed. And man, I hope we can get more of that infrastructure on the ground, if you want to call it that. But this is probably not the place and time, again, with what we have, situation we're in, and the direct services that we're hoping for.
Well, and it funds recovery, which we've funded a lot of recovery and treatment. So
I agree with everything that's been said.
Okay. The next one, prevention support services, the community capacity building. And this one, through the youth prevention model more so. And just as a reminder, just for full transparency, Vice Chair Smith, if you want to reiterate your comments from the last meeting.
yeah, as the previous exec, and I still do work for them, I'm not going to vote on it, but I did find out one thing today, because Youth Connections always worked with the school district to go and I can't think of the word. We would look at the floats for vigilante and make sure that they didn't have alcohol, and that yeah, they were portrayed correctly. So I looked up on Butte Care's website, which they have the contract for this region for all the prevention, and there's nobody doing anything in Lewis and Clark County. So I just want to throw that out. And Commissioner Hunthausen, I would recommend that all of the county commissioners reach out to DPHHS and say, what's going on? Why is one of the top 5 counties not receiving a dime towards primary prevention? Because we had 2 full-time and now there's nothing. Anyway, I will stop.
Thank you.
So they had a revised budget as well, indicating that they could do this in the first year at $43,536.89. If I'm not mistaken, that was the amount that I remember. And we have struggled since I have been a part of this to find someone doing anything with youth prevention. I would welcome this one at that reduced rate, because they're also working in the entire county, not just one district or a specific subset.
I agree with you. One thing that I thought was important, I mean, a lot of legwork has happened in the last year and a half with the Communities That Cares grant that is no longer. So I think that there's some runway to use those resources and relationships that have already been built. I was and I know we're not talking about another grant right now, but I was trying to evaluate, between this and the HIA application. Um, Thoughts are because I think that HIA probably it does serve a specific, very vulnerable population, and normally does so very effectively. So I'm kind of thinking through like, do we have to choose one or over another, or is there? I'm just thinking about how I evaluate the two, either against or together.
I thought the same because I think what HIA can do is effective and helpful. My only concern is it was within one school in one district, and I see the Youth Connections program being broader to now. I don't know on the outset of that if it's more effective to target one something specific or fewer, or excuse me, more, but obviously the time would not be dedicated as much. The only other concern with the HIA program was it was also kind of while they're doing other things, they're also getting to the prevention, where this was more of direct prevention.
Yeah.
But I'm also not a clinician, and I think kids are more affected by not directly talking about it than directly talking about it sometimes. So I don't know. I struggle with the same, but I went back to this one being that it's a wider swath of youth that would be affected than that program. Commissioner Hunthausen, you had talked to me about some thoughts with the HIA. Do you have any today?
Yeah, and kind of the same conclusions. I really like the idea. I like the premise, but a real focus and specific focus on how the opioid connection, and how they were going to work directly on that, on the prevention piece. And I was thinking that maybe we postpone funding them and ask them to come back in the fall with a more specific and more direct kind of request that is a little more focused, maybe, if that makes
Commissioner,
sense.
who's that?
The Helena Indian Alliance.
I think that would be a really productive approach, giving them some specific direction about, we're very interested in the work you're doing, but can you tailor this to more specifically address, opioid preventive measures?
Yeah. And if we were to fund this other youth with Youth Connections, there would be an encouragement to also make sure they're coordinating with them so that we're not duplicating efforts and again spreading that out to. I do think that if they were to come to us in the fall and more specific, and HIA had a obviously different approach, when we look at the evaluation piece on the other side, that we could really get some good information on maybe which one's helping more or having more of an effect, finding more success, and have them both share their thoughts on that. If we were to fund one or the other or both at some point.
Yeah, just for clarification, the prevention support would be a systems, trying to move prevention forward, and HIA is very much direct service with just a handful of kids. But one thing I did like that they had said was, gosh, we would love a van, which transportation is always something. And then I was concerned about their budget as far as possible supplanting. Like, oh, we already have somebody, but we're going to take this money and we're going to move it here, and then we're going to fund this with that. And I was concerned with some of that. And their answer still confused me because I wasn't quite sure what they were doing.
Eliza, do you have something more to add to that?
Yes, Chair. I asked very specifically to the moat. I almost took word for word what Helena Indian Alliance was doing and put it in the email to moat staff. And if just from their perspective, it would not be supplanting. So just if you're, which does not mean that if you all kind of consider it that way, that's one thing, but the moat would not consider that supplanting, if that's helpful.
Perfect. Thank you.
So I do have a question, Mr. Chair, if I could, maybe you can help me understand this. So when I was looking at the capacity building one, or the prevention support services, in my mind, they're trying to build a system of support, technical assistance, collaboration, training, versus direct service as well. And that was where I got caught up on that. And I just wanted to talk about that a little bit. Because I kind of got the feeling that we were all talking about, where are people really tying directly to opioid service, or prevention service, and we had a little less support for those things that are kind of fringe or tertiary. I mean, you have to have a system in order to to provide services, but is that what we're trying to use the money for, to build a system or to actually provide services? Like, hey, have your system built and we'll provide money for you to provide the service. That's where I was kind of had my only conflict with that one. So just help me understand that.
Both. I don't know that we don't have anything as far like chartered that we need to do, but I think the goal is that we're trying to cast the widest net with all of those things with a substantial amount of money, but not enough to do all of it. And my hope would be that we're able to do both direct service and helping with systems. I look at what St. Peter's is doing. Theirs is a little bit of both. They're doing some system building, but they're also doing direct service. Good Samaritan is much more direct service. The jail is direct service. So I think that a little bit of all of it has been at least the approach it seems that we've taken. And I don't think we've had that conversation directly before you or Mayor Dean came on. We've just tried to cast the widest net we could doing all of it. Where, like we've talked about before, other areas are doing very specific. It's all going to one place. They're doing something very specific with it and moving from there. So I think we're just trying to cast a wide net.
Well, I think ultimately we're just trying to reduce opioid overdoses and opioid deaths. And you can't do that without, number one, stopping it before it starts, which is primary prevention. But then also supporting people. So it does take both the systems and the direct support. Right.
Yeah, Mr. Chair, I guess as I was kind of going through it in my head, evaluating these things, I was thinking about, well, because of the limited amount of resources we have, if someone has a system or a training or a specific avenue already set up, then we're helping them provide that training, provide that prevention service, provide that. That's kind of how I was looking at it. But I was just kind of getting that picture from you guys as well, because we have such limited money that we could spend it all very easily on, developing a program or programs or systems, or trying to get the community to support prevention, for example, or treatment, for example, versus providing direct service, I guess. So I was just trying to balance those two and understand where we were on that.
Well, go ahead.
Well, I was just gonna say, on that note, one thing that, and this is my first funding cycle, so I'm thinking, like, as we head towards the fall piece, I know that, having gone through those reports, they are kind of like the, 6-month updates of what are kind of the accomplished deliverables or outcomes. Is it possible for us to get maybe more comprehensive analysis in the fall of, here's the impact of all of the like cumulative impact of all of these organizations that we have funded, so that maybe we can see a broader look in like one glance.
That's what I was trying to do with that one pager, like
Okay,
what have
yeah,
we funded and what,
yeah,
yeah, so I did, but I wanted to go back to Commissioner Hunthausen in their application. It said grant funding is intended for the creation or expansion of opioid prevention, treatment, and recovery. It's not meant to replace or supplant existing funding. So, I mean, that gives us a little bit of what we can and can't do too. Although it sounds like anytime we ask the moat, they're like, oh no, that's not supplanting. No, that's not replacing existing.
Right.
So,
Their
Okay.
definition of supplanting is a lot more loose than the federal
Yeah.
definition of supplanting.
Yeah.
And that's how I've tried to look at it too. But to your point, Mayor Dean, I think that with what Vice Chair Smith has done and created, and with these reports, I think maybe a work session even before our next funding cycle where we look at that and maybe put some of that together would be good and helpful.
yeah. And
Um,
I did forget. I apologize I did forget about that one pager. Does it break it up into like prevention, treatment, recovery? Okay.
yeah. Like we've not spent any money on prevention, primary,
Yeah.
secondary, a little bit on tertiary, if you want to call the Storpy trainings with
the
people
first
that
responders.
yeah. But all of our funding's been treatment and recovery.
Yeah. Well, maybe that means this is the time that we start thinking about the prevention side. Yeah.
And these are the first applications, all but one, which didn't quite get to prevention either, that are actually about youth prevention too.
Yeah.
And so it's been good to at least see that we're getting applications that address that.
Intermountain had youth, but like 5. So
Well, I'll move on to the sheriff's office, medical provider, and MAT bridges. And is James is not on. He did bring up some concerns that he had just heard about and wanting to make sure that how the jail is providing their care, wanting to make sure that he didn't directly have the concern, but they were raised to him about the quality of care. I don't know how direct it is to this program or to any of that, so I was hoping to catch him, but at least honor his concern. I think that in my perspective, which is very much an outside perspective, for the well-being of our detention officers and for the folks that are in the jail that are utilizing the service, I think that getting their service done faster and not having to wait and not having to take 2 detention officers out of the jail at one time to take inmates to get the testing done, I would hope is a better quality of care than what they were seeing before with a much longer delay. I think that this program, I have some concerns because they asked for more and said that if they don't get more, then who knows if these folks will utilize the medications or purchase them themselves. I think that's a broader concern to have once they're released, because if they're not willing to do it while they're incarcerated, are they willing to do it when they're out? Then Medicaid may kick in for some of those folks too, but they obviously don't while they're in the jail. So I don't know. I also do have some thoughts and concerns about it, but I do think that my hope and Mayor Dean, I don't know if this could at all be directly contributable, but is if they're getting treatment options available to them sooner while they're in the jail, that when they're released to the public otherwise, that maybe it's helping with not seeing as many on the streets. That was a very long, convoluted question / statement.
It made sense, and I think you're right on.
Well, Mr. Chair, that is definitely the intent. The intent is not only to, if they have an opioid disorder and they're treating them in the detention center, that they would do actually a hot handoff to either Helena Indian Alliance and or Peerview, who have the certified MAP programs in the community, that they would make sure and try to get the detainee to agree to that treatment post incarceration. That's the goal of the whole thing. And I think you're right about, I think the numbers treated would be down significantly if there wasn't a provider in the detention center. That's my take on it. And I agree that the increase, I think focusing on the provider is really would be the main thing. I think the increase can be covered in other ways, whether it's the sheriff's budget and or other grants that I think they're looking at grants even with the Board of Crime Control and others that have funding available for some of these items. So I don't think they need to get it all from this funding source. So.
Well, and I fear that's almost the entire amount that we were looking to fund this whole funding cycle. So I have concerns with that too, that we're then really narrowing our vision, and I don't think that's the place we need to narrow it. Sorry,
No, Mr. Chair, my concern is that 80,000 was for medication, and who's to say they're going to continue when they leave? So is it just a bit of waste of money? I think you were kind of alluding to that, but I'm for the provider. I think it's given detention staff and the detainees to help both of them get help that they needed.
Okay. We did discuss the Helena Indian Alliance to some degree. Was there any other, first, was there any other comment or question about the detention center? Okay. For the Helena Indian Alliance, any other conversation to give them their fair shake in the agenda at least? I think that the transportation option could be helpful, and I do think that that's a huge secondary, tertiary prevention model, that they have the ability to move kids around and get kids to programs and help them making good choices. But that was also not a primary focus of their request this time. It was also just something part of okay. Well, we can go ahead and kind of go through back to start at the top of the agenda. So the public health grow together. Was there a strong advocate for doing that program?
Is it possible for us to review like
where we would be with money?
Yeah.
So that one was 11,000. Eliza, unless you've already done this.
No, it was
That was
16, I think.
16 is what I wrote down.
Okay.
Yeah, the Lewis and Clark Public Health, the reduced amount was 16.
Excuse me.
But then, Colleen, I think you suggested 13, right?
There was a 13.
Well, if we did half to split with the Region 4.
Good Samaritan revised was 100,000 on the nose.
Yeah.
Peerview, we all agreed, and we'll vote on this, of course, but we've got to make the sausage here. Good Samaritan, or excuse me, Peerview was a no from all of us, so not considering that one in this. Peerview for I'm sorry, not Good Samaritan, excuse me. Good Samaritan was 100,000. Peerview was a no from us. Recovery Friendly Montana was a no for us. Montana Legal Services was a no from us for this cycle. Prevention Support Services was a possible, and that one was 43,536.89.
Correct. That was that was Chair.
Revised.
That was the partial.
Okay.
There
Lucy, go ahead.
Two options from that. Did you see that?
I did see that.
Okay.
Now that you say it, I think the one that I have on what I'm looking at was the higher amount.
Chair, the higher amount was 76,593.
Okay. So I don't know if you want to write them both down, but
Sure.
that, yeah, there were two amounts. You are correct, Vice Chair Smith. Thank you. Lewis and Clark County Sheriff's Office, that one came in at 115. And then the Helena Indian Alliance, did I hear that we're encouraging them to come back with a more targeted application in the fall? If I'm wrong on any of that, please correct me.
No, I think that I think that's correct.
Okay.
I mean, I'd really love to see us fund something because they, the data is pretty clear about Native populations being disproportionately affected. But I also think we want to make sure if we're putting this money towards prevention, we want to make sure it is going towards prevention.
Mm-hmm.
Agreed.
And I want to see a wider swath if possible too. I always want to see that throughout more than just the Helena School District,
Yeah.
but throughout the whole county.
Yeah.
But I don't know where their mission within that kind of falls either.
Well, I think if we could get them into all three high schools,
Yeah.
I mean, that could be a really great place to be.
Or the middle schools. There's
Yeah.
a lot less to do there.
Yeah. And that's where too, I don't know if their service territory includes Lincoln and Augusta and or if it stops at the Helena Valley. So that could be a question for them too. But I would like to see them throughout the county as well. And maybe it doesn't, so I don't know. Okay. So Eliza, what's the grand total for that? More
So
than what we've got.
Yes. So if we did the lower amount, the 43,536 for prevention support services, we'd be at 274,736 and 89 cents. If we did the higher amount at 76,593, we'd be at 307,793. And I'll put that in the chat so you can, if you guys are
Okay.
like me, I need to see those things.
And that's including the 16,000 for public health.
So that would be including the 16,000 for public health, 100,000 for Good Samaritans, the either 76 or 43, and then the 115,200 for the provider for the detention center. And I will put those, I'll put that in the chat just so you all have that in front of you.
But that's not the public health. That's not the, sorry, let me find it.
Home visiting.
The Grow Together.
It is. Yeah.
Yeah.
That would be
It is.
16,000 for public health. Yes, that includes
okay.
the 16.
Excuse me. Okay.
So I will.
So we as a committee have the discretion to award all of the amount. Part of it, the goal was to be as close to that middle as possible, just to give us something for the fall. We won't see another tranche come in before the fall funding. And then that fall funding would occur January 1. We would award it in the fall, but then that's when it would go into effect. And correct me if I'm wrong on that. But
Mr. Chair.
yes.
So we would get a second tranche in July. At July 1.
That's when we're awarding. This is that.
Correct. So we
Yes.
have $69,000 currently. We would get an additional $400,000 on July 1.
Right. So what we're awarding today would be awarded July 1.
Correct.
Yes. But there isn't anything else coming in before July 1 of 27.
Correct.
Yes. So with our 469,153.50, if we were to do what we said today, it would be the 276,000, which would leave us roughly, where would that leave us?
Chair, can you say that one more time?
So we have the 469,153.50.
Mhm.
And what was that total amount if we were to do the lower amount of the
The lower amount would be
276 something you said?
274, 736.
So that would leave us 194, 417.50 for the fall award. Thoughts on that?
Mr. Chair, in trying to think ahead of who might actually be applying again, I mean, Helena Indian Alliance probably will for sure. I just hate
Mhm.
to, we have a lot here of, decent things. I would hate to shortchange ourselves just trying to save some for the fall when there may not be a lot of applications. Does that make sense?
Mhm.
Yeah, Mr. Chair, I would recommend that we fund the ones we described today, the four at the 274, whatever.
And that's the lower amount for the Youth Connections.
Correct.
Are any of you advocating for the higher amount for the Youth Connections program? And then to Vice Chair Smith's comments, then that would leave less, but we would be funding them at a higher level.
Yes, it depends on what comes in.
Yeah.
Mm-hmm. So any advocates for the higher amount for the Youth Connections program? I hear none. So I will take that as the lower amount is good. And then if they choose to in the future, that's where I think if you're a strong applicant in the future showing good progress with what you've utilized, then that's more potential for increasing the amount in the future, possibly. So what I will do, especially because Vice Chair Smith is going to recuse herself from one of them, is we'll go through and we can vote on them individually if that's fair to everybody. Then we have it on record of what that's for.
So just to be clear, I think I asked this in our regular meeting, but I don't have to recuse myself. Is that correct? Just two county things. Okay.
Not unless you were on the board or had a direct financial impact by one of them.
Okay.
Is how we've kind of done it in the past.
Okay. Thank you.
Mm-hmm. And the precedent is that in the past, the only recusal was if we sat on a board. Commissioner Rolfe sat on a board of one of the organizations, Commissioner or Vice Chair Smith is, but otherwise, just because you are also a county employee did not preclude you from voting, did not preclude this role from the county from voting in the past.
Thank you for clarifying.
With
Okay.
that then, Mr. Chair, I would move that we approve the prevention support services at a rate of $43,536.89.
Second.
All in favor?
Aye.
Aye. Okay, so we have three. We have an abstention from Vice Chair Smith, and then James is excused. Okay. Looking for a motion for the Lewis and Clark Public Health Grow Together at the roughly 16,000. I don't have the exact full amount.
I have
think
a
we're
flat
saying-
16,000.
Okay, well then that makes it easy. Looking
So
for a motion
moved.
for that. Okay,
Second.
second. All those in favor?
Aye.
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 Any opposed? Okay. Good Samaritan Ministries stops campaign, looking for motion to approve at the $100,000 level.
So moved.
Second.
Second.
All those in favor?
Aye.
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 Any opposed? Okay. I will move on to those that we discussed. The last one is the Lewis and Clark County Sheriff's Office Medical Provider and MAP Bridges Program. Looking for a motion to approve the $115,000 for the provider in the jail.
So moved.
Second.
Second,
Oh,
Mayor Dean.
it looks like we have a hand up.
Oh,
Thank you, Mayor Dean. Chair, I just wanted to point out that in their response to the minimum amount, it was 115,200. So I
gotcha.
just, if you all want to do that.
I appreciate that. Well, then I will uh, ask for reconsideration motion of the $115,200.
So moved.
Thanks. In the second.
Second.
All right, Mayor Dean. All those in favor?
Aye.
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 Any opposed? Okay. The others that we had discussed, I will just look for a motion for the PureView Health, Recovery Friendly Montana, Montana Legal Services, and the Helena Indian Alliance to move to encourage them, or I will look for a motion to deny those applications, and we will send them communication on future application options.
So moved.
Okay, Mayor Dean, second.
Second.
Thank you, Commissioner Hunhausen. All those in favor?
Aye.
Okay. Any opposed? Seeing none. All right. So we will have Eliza, $194,417.50, I think. Is that correct?
Yes, let me do quick math to make sure that is correct.
Definitely want my math double checked. And while she's doing that, one other comment is what we approved today will go on to the state moat. They're the ones that officially approve this, and that's why we needed to get this done before their April meeting so that we can then fund by July 1. And they will make the final decision, and they will let us know if there are any questions in the meantime. So far, we have had success with that, and hopefully we will continue to have success with that, them approving the applications we forward.
Sorry, my Excel just keeps telling me it's 0. So clearly there's something wrong in my Excel form. So I'm going to use a calculator.
Okay. And I don't see, that's what you got. Okay.
Yeah.
194, 416, 61.
Oh, I just added these odds.
Great.
I'm sorry. I didn't do that. I just was trying to make sure that this number was correct.
So Chair, I have for the remaining 194, 416, 61. Was that what you have?
Okay. I was a couple dollars off, so I'm not, that may have been fat fingering, so I apologize, but that's about what I figured. So that's terrific. And I think then when we come back for the fall, knowing that, we now know what we have. When will before we do that, I'll ask for public comment. I don't see anybody, but we're in here as panelists. I didn't know if there was anybody waiting or otherwise. Is there any public comment?
Well, Mr. Chair, I just had a question. I'll wait till whatever.
Eliza has a question.
Yes, Mr. Chair, I just wanted to, I think I missed this at the beginning. For the St. Peter's Health, does that one, do you all need to vote on that, or was that approved? Did I miss that?
We
So
didn't vote.
we didn't vote on it because it was just a 6-month review. Their application for the future will come for the fall.
So the 174, the
Mhm.
174, 835, they applied for last September.
Mhm.
And it was held, that 174 was held from the moat from last September until it was approved after we got their 1-year report from their last grant.
Oh, I
Does
misunderstood
that make
that
sense?
completely. It does. I misunderstood that
I
completely.
apologize that that was not clear.
But we are not taking that money out of anything that we have today. This is from the before.
That's from before. So that's already, I confirmed with the moat that is allocated from what you all had. So all you need to do today is, based on the report that you all received from them in March, whether
Mhm.
you want to approve that 174, 835.
Okay.
That's separate. Does that make sense?
It does now, yes.
Okay.
So my apologies for completely misunderstanding that. I'm glad you said something. This is just cleanup with our new process of 2 times a year, where before we were taking it as they came in and reviewing them. Okay. Does
Correct.
that make sense to everyone? Are there any questions about the St. Peter's 1 year progress or the request to approve them from September? So they'll get, if we approve them today, they'll get their money right away. The others
Correct.
will, as mentioned, after
Yep.
July 1 is when they will get their funding.
Correct.
Well, then I will look for a motion to approve the St. Peter's program application that we had reviewed back in September and in coordination with their 1 year report.
So moved.
A second.
Second.
Okay. Commissioner Hunnehausen, thank you. And all those in favor?
Aye.
Aye. Any opposed? Okay. Thank you for clarifying that, Eliza. We are cleaned up now. And then the only other item, I will again seek if there's any public comment. Amanda, anybody in the waiting room or waiting for us?
Mr. Chair, we do have one attendee, Kayla
Okay.
Morris, but she does not have her hand raised. So
Okay.
if you would like to give public comment, Kayla, feel free to raise your hand. Otherwise, I think we're ready to move on.
Okay. All right. Seeing no public comment, is there? Can you tell us when our next meeting will be in the time frame? It will be.
Chair, we have not set a date, but we'd be looking at a June or July meeting.
Okay. Do any of you have any? I know we have 1 minute left. If we have everybody's time for another minute, a preference or Monday afternoons, are those workable for folks?
Usually.
Okay.
I think it's preferable for me if it's like before 2.
Before 2?
Yeah.
Okay. Do we want to set one for June? End of June?
I will be gone the last week.
Is that the 29th or the 22nd?
Leaving the 24th or 25th, I think. Let me
Would
see.
the Monday the 22nd work?
Yes.
Like noon?
Noon?
Is that okay?
Yeah. And in that one, we will review old applications or any 6-month reports, not old applications, but any current programs. In addition to that, we will, maybe Mayor Dean, to your point, looking more at the data of things and talking about it and seeing what else we can glean from the process, will be on the agenda.
Cool.
Sound good, everyone?
Yes.
And then
then
you all will send out a
Yes.
1 o'clock. You said 1 o'clock, Mayor Dean?
I said noon, but
Noon, excuse me. Noon on the 22nd of June. Okay, sorry, Vice Chair Smith.
sorry, Chair, just a reminder that we're doing the Kiwanis presentation on Monday at noon. So
Yes, so whoever wants to join at the DoubleTree at noon here in Helena, and Colleen, you and I can work on that in the meantime. And then
yeah,
still waiting to hear back on when for Hometown Helena, but we'll keep you posted on that as well.
And Chair and Vice Chair, I can get you, it's this coming Monday?
Mhm.
yes.
I can get you those slides. I can send them over this afternoon of what we had for the community assessment, which is very
Okay.
specific to this program. I can send you over those specific slides.
Perfect.
That would be terrific.
I will get that put together.
And if anyone else is able to join, you're welcome to it. If we do have any more that join, we'll just need to notice that. But you're welcome to. I'm sure Amanda's familiar with that process. Okay, anything else for the good of the order? Okay, sorry, it took an extra minute of your time. Thanks, everyone. I'll adjourn this meeting at 2:01. Thank you all so much.
Thank you.
Thank
Good to
you.
see
Happy
everyone.
Easter.